Here's how long it typically takes to train and license a new doctor in Nova Scotia. And here's how much it costs. But with the new Physician Assessment Center of Excellence, or PACE, here's how long it takes to license a mid-career doctor in Nova Scotia. And here's the cost per doctor through PACE. Far less time and at a significantly lower cost to Nova Scotians. So you may be wondering, why hasn't Nova Scotia been doing this all along? To answer that, let's take a closer look at our broader strategy for training, recruiting, and licensing more doctors, and where the plan will take us next. To start fixing healthcare, we did something Nova Scotians hadn't seen in years. We listened. We traveled the province to hear from the people doing the work: nurses, paramedics, CCAs, doctors, pharmacists, and more. And we also looked for ideas from around the world. After all that listening and learning, we got to work. We opened a new medical school at CBU to train more doctors for rural Nova Scotia. We modernized pay and contracts, and we cleared out old rules that kept skilled professionals from working to their full scope, the heart of the Patient Access to Care Act. Because if you're good enough to practice in the UK, the US, Australia, or the Philippines, you're good enough for Nova Scotia. And that brings us back to PACE. The Physician Assessment Center of Excellence is now open, and it's brand new to North America. The center assesses internationally trained doctors while they're actively caring for patients. A new way to get qualified doctors practicing here without years of waiting, while saving the province millions over time. Better yet, all patients are assigned from the NIDA Family Practice Registry, a list down from almost 160,000 people.
There's a clinic that's been going for not even maybe around a year in Nova Scotia, where they're bringing people through, and the whole clinic's purpose is to assess internationally trained physicians over a 3-month period while providing care to patients. And if we could have funding for clinics like that across the country, that would be an amazing opportunity to both increase care that's being provided while also assessing those physicians and they're functioning under supervision and getting that assessment done so that hopefully they can then go out and join the workforce.
Here's how it works. Physicians spend 12 weeks at the center, working under the supervision of Nova Scotia doctors. If they demonstrate the skills needed for independent practice, they earn a license and sign a 3-year return of service agreement to stay and practice right here in Nova Scotia. Once fully scaled, the center will include 5 physician-led teams, each working with up to 3 internationally trained doctors at a time, and the clinic will serve roughly 6,500 patients. This model blends 3 parts into one streamlined process: a collaborative orientation program, a hands-on assessment program, and a fully functioning primary care clinic where physicians provide real care while being evaluated. Because everything happens in one place, doctors work as a team, they share expertise, and they stay focused on evaluating clinical skills. And because assessments are competency-based, doctors can enter on a rolling basis and finish as soon as they meet our standards. For patients, PACE feels like a normal primary care clinic. You're attached to the clinic itself, which means consistent team-based care. And as physicians complete the program, patients can stay at PACE or follow their doctor to their new clinic while the next group steps in. These doctors are already providing care in various communities across Nova Scotia. And we are now working with other provinces and territories to help them too. We are leading the way. PACE is designed to bring more doctors into the system, faster, giving thousands of Nova Scotians access to timely primary care. It is a game changer for our province, and the rest of the country is taking notice.